Several developments in the widening Ebola crisis. The fifth American diagnosed with the disease is stable this morning. Shaka Mukpo is being treated with an experimental drug in Nebraska. Test results for a Texas sheriff's deputy who complained of Ebola-like symptoms came back negative. And overseas, doctors say a Spanish nurse's assistant is stable this morning after she was infected.
European governments are stepping up their efforts to contain Ebola. There are fears the disease could have spread to the UK. A British man suspected of contracting the virus died in Macedonia. Ebola has claimed almost 4,000 lives in West Africa. The man leading the fight in the U.S. is CDC Chief Dr. Tom Frieden. Well, he issued a worldwide call to action on Thursday.
I will say that in the 30 years I've been working in public health, the only thing like this has been AIDS. And we have to work now so that this is not the world's next AIDS.
I'm sorry, go ahead.
Chief Medical Correspondent Dr. Jon LaPook is here. John, good morning.
Good morning, Nora.
What do you think of Dr. Frieden's comments that this has the potential to be like AIDS?
I understand it. I was an intern when AIDS hit. And it was the same sort of fear. A lot of the fear was irrational. You had these numbers that were increasing slowly, inexorably. And the sense, you know, what are we going to do about it? I think one of the big differences is that HIV was able to be spread when people were asymptomatic. And unfortunately, in the case of Ebola, people are either surviving or they're dead after 2 to 3 weeks. So you don't have that insidious spread that way. But yeah, I think it's the same sort of thing where you're thinking, you got to stop this now.
Where are we in terms of having the latest vaccines available in West Africa?
Well, they are really fast-tracking the vaccines. There's now, in Mali, the United States, and the United Kingdom, the first vaccines are rolling out, and they're actually been tested in a small number of people. So even though it normally takes years and years, I think we're going to see this fast-track, but nothing's going to be available until widespread for certainly many months.
And Shaka Mukpo, the cameraman who is being treated in Omaha, he got that blood transfusion from Dr. Kent Brantley, who's recovered from Ebola. When will we know if it's worked?
Well, normally, I just reviewed this again in the New England Journal about the current outbreak. Usually an average of 16 days from symptoms to being let out of the hospital. And 6 days on either side of that either way. So after 2 to 3 weeks, you should know whether the person's going to be recovered. And this is an old treatment where you're giving antibodies from somebody who's recovered and they can go in and hopefully attack the virus.
From what we're seeing in terms of those patients who've contracted it, are we learning anything more about how it can be transmitted? Are there new questions about that?
Well, I think that one by one we're starting to get the epidemiology of this and the numbers down. And again, this New England Journal review looked at this virus, which looks like it's the same, it's behaving the same as all the previous viruses, which is good because there's a lot of talk. People are worried. I understand it, that it could change, it could mutate, it could be different. It seems like it's behaving the way the virus has behaved in the 24 epidemics before us in the last 40 years.
All right, John, thank you so much.